Frustrated by the miscarriage or miscarriages you have had? Sad, upset, and don't know what to do? In this video, we will be talking about what you must do to avoid any further miscarriages from happening. Hi, I'm Dr. Kady. I'm a certified family clinician with many years of experience in supporting many women who have experienced miscarriages. The clinical definition of miscarriage is the loss of a fetus before 24 weeks of pregnancy. If this happens in the first 3 months of the pregnancy, it is known as first trimester or early miscarriage. When early miscarriages happen 3 or more times, this is known as recurrent miscarriage. These do not have to happen one after the next. You may well have had perfectly healthy pregnancies in between those miscarriages. And the first step in avoiding a miscarriage will involve lifestyle factors. Now, I have already discussed many of these lifestyle factors in my previous videos. And so I will put a link to some of these videos in the description box, and you can check out what those life factors are and how they contribute to preventing a miscarriage. I will mention some of these factors briefly in this video, but for more details, check out the videos in the description box. In the aim of avoiding a miscarriage, there are things that you must do before you fall pregnant. These are the preconception measures that you must take. Let's look at them in detail. The first is managing chronic conditions. A very common chronic condition that may lead to miscarriage is high blood pressure. Having high blood pressure for a long period of time can affect the blood vessels that supply the placenta with oxygen and various other nutrients. This can lead to problems with placental development and function, which are crucial for the well-being of the fetus. If the placenta is compromised, it may contribute to a higher risk of miscarriage. Another impact of high blood pressure is reduced blood flow to the uterus, impacting the uterus' ability to provide an optimal environment for the developing fetus. Not having enough blood flow to the fetus compromises the growth of the fetus, and this leads to the increased risk of a miscarriage. Another reason why you want to manage your high blood pressure before you fall pregnant is that having high blood pressure increases the risk of developing blood clots. Blood clots interfere with blood flow to the placenta and the uterus, and ultimately the amount of nutrients and oxygen that the fetus receives. This eventually leads to fetal death, which then manifests as a miscarriage. Another condition which is absolutely imperative for you to manage adequately before you fall pregnant is diabetes. Poorly controlled diabetes during pregnancy increases the risk of birth defects and miscarriages. Diabetes affects the development of the fetal organs, and so the risk of structural abnormalities in various organs is observed in pregnant women with poorly controlled diabetes. And sometimes the structural abnormalities in these organs may be too severe for that fetus to survive, therefore leading to a miscarriage. Some of the specific defects that can be seen in pregnant women with high blood sugar: congenital heart defect, neural tube defect, and for women who thankfully, despite their diabetes, do not have a miscarriage, there is still a risk of having a preterm birth. This happens when the neural tube doesn't close properly. And this neural tube is needed for the early brain and spine seen in the fetus. And as this defect happens early on in the pregnancy, it is absolutely crucial for your blood glucose to be adequately controlled. Diabetes also affects vascular supply. So high blood sugar will compromise the supply of oxygen and nutrients to the uterus, ultimately affecting the amount of nutrient and blood that the fetus is able to receive. And this therefore can lead to a miscarriage. Those with diabetes are more prone to infections. So infections during pregnancy, particularly the ones that are present within the uterus during a pregnancy, can lead to a miscarriage. There may be a link between high levels of a hormone called prolactin, which is released by the pituitary gland, and miscarriages. So if you are someone who has experienced a miscarriage, just for the sake of thoroughness, it may be worth you speaking to your doctor and requesting for a blood test to check your prolactin levels to ensure it is not raised and is not overlooked as a reason why you may have had or may be having miscarriages. Maintaining a healthy weight cannot be overemphasized. If you are overweight with a BMI of over 25, or even underweight with a BMI of less than 18.9, you have an increased risk of having a miscarriage. This is because weight affects the balance of the reproductive hormones. Don't overlook the importance of maintaining a healthy lifestyle. And that includes having a balanced diet, which should be a diet that is rich in folic acid, calcium. We have a video on this channel that looks at diet that helps boost your fertility. So make sure that you check out that video. You should consider including plain unsweetened yogurts, which are considered to be probiotics and helps you to maintain good gut health. And foods that are rich in folic acid are spinach and citrus fruits. Again, I'll refer you to that video where we've done an extensive video about the foods that will help you whilst you're trying to get pregnant. And so if you are having miscarriages, making sure that you're including these foods will also help you avoid miscarriages. Also, you must avoid junk food because it increases your risk of gestational diabetes, and gestational diabetes will cause all the complications that I've mentioned earlier. Make sure you're taking regular exercises, regular walks. If you're actively trying to fall pregnant, make sure you're not doing anything overstrenuous in the gym. Again, that could lead to a miscarriage. Any form of exercise that will slightly increase your heart rate is sufficient. Limit your caffeine and alcohol intake. In fact, with alcohol, the recommendation is that you take no alcohol at all. And avoid smoking and illicit drugs because smoking affects the blood vessels to the uterus. If you've had recurrent miscarriages, it will be mandatory for you to see a gynecologist before seeking to fall pregnant again. It's scripture time. Today I'll be sharing from John chapter 10, verse 10. The thief comes only in order to steal and kill and destroy. I came that they may have and enjoy life and have it in abundance, to the full till it overflows. The thief's sole intent, as far as the flock is concerned, is to sow chaos. Here the thief is the devil and the systems of this world. Jesus, on the other hand, aims to safeguard the sheep's whilst enhancing their life. As a follower of Christ, we are his sheep. Jesus is the exclusive door by which one can be saved. Jesus's purpose extends beyond mere existence to encompass an abundant life. This abundant life transcends mere material wealth and prosperity, as highlighted in Colossians chapter 3, verses 2 to 3, and Matthew 6, verses 25 to 32. It starts with deliverance from the eternal consequence of sin. An abundant life is first and foremost eternal life. It involves flourishing in a life marked by the fruit of the Spirit, whilst the devil and the systems of this world offer fleeting solace. Only Jesus provides true everlasting life and spiritual abundance. I pray that this scripture has encouraged you and given you hope. Now, on to the things that you must do once you fall pregnant again. The first is see your doctor as early as possible once you find out that you are pregnant again. This is important because the risk of having another miscarriage can be identified early, starting with routine things like doing early blood tests. For example, as a result of doing the blood tests early in your antenatal journey, it may be found that you have a problem with your thyroid function. High levels of thyroid stimulating hormone or the presence of thyroid antibodies may put you at a higher risk of a miscarriage. However, well-controlled thyroid disease does not cause miscarriages. So if it is found during your pregnancy that you have thyroid disease, then it can be managed with medication and it may never impact your pregnancy at all. But the key is finding this out early. Taking aspirin during your pregnancy may be key in preventing some women from suffering another miscarriage. Now, wait a second, ladies. As I've always said on this channel, do not just listen to me and go ahead and practice some of the things that I'm saying, because clinical situations will vary for each and every single one of us. So do make sure that the recommendations I'm making on this video are always discussed with your own doctor as to whether or not it's applicable for you. Now, back to the reasons why aspirin may be beneficial for some women during their pregnancy. Taking aspirin may prevent preeclampsia, especially for women who have had high blood pressure in previous pregnancies or have high blood pressure before falling pregnant. Aspirin should always be given in women who have a history of antiphospholipid syndrome. And in this condition, the antiphospholipid antibodies can increase the risk of blood clotting. And so aspirin may help to reduce this risk. Other clotting disorders, such as thrombophilia, aspirin is great at preventing clots in women with a background of clotting disorders. Also, aspirin is beneficial to prevent intrauterine growth restriction. In these cases, aspirin improves the blood flow to the uterus and reduces the risk of intrauterine growth restriction, which is where the baby doesn't grow to the expected date. And finally, aspirin is also beneficial in women with multiple pregnancies. For example, women who are carrying twins or triplets, who are at a higher risk of preeclampsia and other complications. As soon as you find out that you are pregnant, you must take folic acid. If you have no other condition, you're fit and well, you must take 400 micrograms of folic acid, which will usually be 1 tablet daily for the first 12 weeks. However, if you are a diabetic or you have suffered multiple gestational diabetes, that is diabetes during pregnancy, your dose may be higher. You may be recommended by your doctor to take folic acid 5 milligram daily for the first 12 weeks or possibly longer. Again, check with your own doctor. And finally, something that you may want to discuss with your doctor is if you may be suitable for a progesterone pessary. Taking progesterone early in the pregnancy within the first 16 weeks is recommended for women with a high risk of early miscarriage who are having vaginal spotting or bleeding. So please don't rush to your doctor demanding for a progesterone pessary. The clinical situations, as I've always said, vary. That's it for this video. I truly hope it's been helpful and provided a source of hope for women who have experienced a miscarriage or multiple miscarriages. I look forward to seeing you in our next video. And if you have suffered a miscarriage or multiple miscarriages, please share your experience, what you may have done, what you feel I may have left out in this video to encourage another woman. Let's support one another in this HeyDoc community. Take care, and I look forward to seeing you in our next video.